My name is Edwin Charle, and I am the medical director at Salmon Falls Family Healthcare. Salmon Falls, we started in 1987, and both my partner at the time, Dr. Clary, and I were in Brooklyn. We had done our residency training together, and had young families at the time, and were thinking of leaving the metropolitan area and moving. And so we started looking for advertisements for opportunities, and one of them came up in New Hampshire. So we answered the ad. We've got a lot of great practitioners working here at Salmon Falls. Claire Menard is a pediatric nurse practitioner and is very popular and spends a lot of time with her kids and new families. That's been very helpful. I think that we also we make a special effort to be available to our patients. Patients are able to call and get answers the day of their call. We do a great deal to open up space so that we can see people for same-day visits, which come up a lot of the time. My practice has evolved over the years. When I was in training, I actually was very interested in doing a lot of obstetrics. So I did a lot of my training with obstetrics. As it turns out, from a practical nature, that was a difficult thing to do. And moving up here with a very strong OBGYN specialty group, it didn't make sense for me to keep doing any OB. So I have not been doing that, but I have been mostly seeing elderly patients, and that's not only in the office, but also at a lot of the long-term care facilities in the area. So my practice at this point is not restricted to, but definitely geared towards seeing the elderly. One of the unique parts of Salmon Falls is that we're still a privately owned practice. I think that gives us a degree of independence that other practices may or may not have, and allowed us to grow and change in ways that have, I think, been probably more responsive to the needs of our patients. I think I've been very lucky to have this particular job. I mean, working at Salmon Falls, and as a family practitioner, I think I get the benefit of working with people one-on-one all day long, and with interesting people, and never a dull moment as far as what people's problems are and how to go about designing a solution or a treatment plan that really fits a patient. So I think that's been my favorite part, is just working individually and being a family practitioner.